Hey everybody, Dr. Lindeman. I just wanted to go over something with you today. So this came out in July of 2015. The FDA put a news bulletin out, and it was on a local news station in a different state. Sorry, it wasn't local, but I posted on our Facebook page. And if you're not a Facebook fan yet, please go to Facebook, look up Lindeman Chiropractic, and like us. And we post articles and a bunch of stuff on there, so blog, all sorts of stuff, just trying to get more information out to the public. And anyway, this FDA news story was about how they released an update saying that taking over-the-counter pain medication, or NSAIDs, which NSAID stands for non-steroidal anti-inflammatory drugs, which is basically ibuprofen, Motrin, Advil, naproxen, which is Aleve, those type of products, can actually increase your chance for heart disease and stroke. So, I wanted to go over a little bit about that. Chiropractic is so much more than about pain. We're really treating the nervous system, but still the majority of patients that come into our office come at first because they have some sort of, discomfort, some sort of pain. Once we start treating them, they realize it's a lot more than that, and we can help a lot more than that, which I'll get into later. But just to go over what this news bulletin said, this is directly from the FDA website. Basically it says that non-steroidal anti-inflammatory drugs can increase the chance of heart attack or stroke, either of which can lead to death. Those serious side effects can occur as early as the first few weeks of using the NSAID, and the risk might increase the longer people take them. Basically what that means, a lot of people think, well, it's probably if you take, a bunch of those drugs, or, if I take them every day. Well, that's true. It does increase your risk if you take them, but this says basically it can, even with the first couple of pills, it can increase your risk. Here's a quote from Dr. Judy Rakusin, who is the Deputy Director of the FDA's Division of Anesthesia, Analgesia, and Addiction Products, which basically means she knows what she's talking about. It says, there is no period of use of NSAIDs shown to be without risk. So no period without risk. Now, sometimes medication's needed, I'm not saying that it's not, but reaching for an Advil, an Ibuprofen, or anything like that, anytime you have an ache and pain is probably not the best idea. Headaches, honestly, the first thing you should reach for is water. A lot of times it's basically due to dehydration. Second thing is, call your chiropractor. The spine definitely has an issue there. Massage, physical therapy, exercise, a lot of that plays a role. I would do any of those things before you start putting things into your body that can, increase risk of stroke and heart disease. So a minor headache compared to risking risking heart disease is not a very fair trade-off. Again, like I said, chiropractic's a lot more than back pain, and neck pain and headaches, but a lot of our patients come in with that, and we have over a 90% success rate, so 9 out of 10 people get better, which is pretty phenomenal if you think about it. I don't know how many patients I've had that have stopped taking all medications. We had a few today that actually told me that's the first thing they've noticed since beginning care. They don't take as much medication, and not just ibuprofen, stomach pills, all sorts of stuff like that. The side effects of chiropractic are really beneficial, which I'll get to. On that note, side effects of ibuprofen, this is from the website drugs.com, where basically they go over all the side effects of any drug, and just get right to it. More common side effects of ibuprofen are abdominal pain, cloudy urine, diarrhea, difficulty having a bowel movement, which is basically constipation, heartburn, skin issues like itchy skin, shortness of breath, trouble breathing, bleeding gums, unusual tiredness or weakness, vomiting, weight gain. What they consider rare side effects are blood or urine in the stools, black, bloody, or tarry stools, which is not good, blurred vision, change in vision, confusion, difficulty swallowing, extreme fatigue, swelling, hair loss, hostility, impaired vision, irritability, liver problems with liver enzymes, rash, seizures. I'm kind of skipping a lot, you can see. Vomiting of blood, swollen glands, crying, depersonalization, feeling sad or empty, paranoia, sleeplessness, trouble concentrating, and inability to sleep. Even though some of those are rare and the first ones were common, I don't want any of those side effects, So, like I said, I'm not trying to say you should never take medication. You should never take ibuprofen. Sometimes it's needed, but I would say don't reach for that as your first tool to help you with aches and pains. Do something else. Like I said, chiropractic really helps. I'd be honored to be that chiropractor. If you're not in my area, I'll find somebody who is in your area that can help you. So please send us a message on this site or email us. Just go to lindemancchiropractic.com and you can contact us there. We're on a couple different pages. We actually have a Pinterest page which I thought was weird at first, but it's a great way to post quick articles about chiropractic. So we're out there, find us and I'd be honored to help you. Again, just, quick news flash is try not to reach for the pain medication. Let's do something else first. And again, thanks for listening. Thanks for watching. And I'm honored to help. Thank you.